maybe I'm fine. Kinda wanna die and I kinda wanna live in life.
Alright, so this is our Critical Question 3 summary video for Core 1. Only 2 dot points to cover in this video, but unfortunately, as you know, healthcare in Australia was quite a large dot point, so that will take up the majority of this time, but I'm going to do my best to try and absolutely blitz both dot points in less than 20 minutes. So let's go. Okay, first dash, range and type of services in Australia. So we know that we have public services and we have private services, okay? So public services are generally ones that are going to be covered by Medicare or the majority covered by Medicare. So those services can still elect to charge a gap fee, which is above the bulk billing schedule. So you will need to obviously pay that difference when you go and see those services. However, the majority of it will be covered by Medicare, which means that most of it will be free, okay? Or at least heavily subsidized, all right? We know that, like later on in the video, I'll touch on it again, but we should know by now that public services have waiting lists, okay? You wanna go for the cheap, that's fine, but there are consequences to that. Private services, okay? Some of them actually are covered by Medicare to a degree, okay? But most of them are not. However, what they are covered with or subsidized with is private health insurance, okay? So if you get private health insurance, it may say that we'll cover 65% of your fee to go and see a physio or a chiro or whatever, up to like a cap of like $300 for the year. And that's usually, for most people, ends up being like 4 or 5 sessions, okay? So if I wanted to go see a chiro, my chiro, that is covered by my private health insurance. I still have to pay a gap because they only cover 65%, and it's 65% up to a maximum of $250 that year. So if I want to go and see my chiro charges me $100, okay? 65% of that is covered by my health insurance, so $65. I pay $35 to the chiropractor out of my own pocket, but then that $65 that was covered, once that gets to my cap, which is like $200 for the year, I then, if I want to continue seeing the chiro, I've got to pay the full $100 every time. Now, examples of public and private health services. We've got GPs, so general practitioners, doctors, nurses, skin checking clinics, dentists, hospitals, health promotion agencies like Cancer Council, physiotherapy, chiro, like the list goes on, all right? They do ask questions in the HSC about like, can you name a range of healthcare facilities and services? Well, there's like 7 of them. And you should know that most of these things will either be public, private, or they can be a combination of both. So for example, a GP, you can have a public sector GP and you can also have a private sector GP, all right? Nurses, most nurses are actually public. Obviously, if the nurse is working in a private clinic, then they will be private. Skin cancer clinics, most of that stuff is going to be private. However, some are actually public because the doctor can refer you to go get your skin checked because they're worried about the mole or whatever. Dentists, same as skin clinics, most of them are private, okay? However, if you're in a hospital setting, you need dental, that will be public, okay? Hospitals, you know that there are public hospitals and private hospitals, all right? When we get into things like physiotherapy, however, 99% of the time that is just a private service, okay? Unless it's delivered by a hospital. So if you were coming back from like an ACL reconstruction, whatever, and you went through the public system for that, you could attend the hospital for physiotherapy. So in that setting, it would be public, but most of the time it's private. So that's range and type. All right, responsibility for health facilities and services. So who is responsible for the things that we look after, all right? So we have 3 levels. We've got federal or Commonwealth government, interchangeable terms, right? Basically all of Australia. What do they look after? They look after policy development, so from the top that's delivered to all states and territories, such as closing the gap, okay? Medicare, the Medicare system runs all the way throughout Australia, obviously outlines the bulk billing schedule, the percentage of taxpayers, etc. So that's all federal. And then PBS, Pharmaceutical Benefits Scheme, all right? So how much a medicine or a prescription medication should be covered by the taxpayers' money. State government get into the nitty-gritty health services. So all the individual health services and things that you would generally consult and visit, except for GP, would be state. So like hospitals, ambulance, cancer screening, mental health services, all right? So like New South Wales Health. Anything under New South Wales Health is obviously up to the state government, New South Wales. Finally, we've got our local government. So like in our local community, okay? What do they look after? Community programs such as Meals on Wheels, Nurses on Wheels, all that kind of stuff. Work health and safety, all right, for the local area. Waste disposal, hygiene. And finally, the other big one is like community health centres, you know, just like your local GP office will be part of our local government stipulation, but then they are sort of directed by the state government, and then the state government is also directed by the policies up in federal government. So they all do link in together to deliver healthcare for Australians. That's responsibility. All right, next one, equity of access. So how equitable is Australia's healthcare system? You know, it's fairly equitable because of this thing called Medicare, all right? You have to keep going on over the same thing, so you better get full marks on this in HSC. Positives of Medicare. I know this is not really great pluses. It was an afterthought, I'm sorry. It's accessible by all Australians. It is taxpayer funded. It covers a scheduled fee set out by the federal government, and it includes the PBS. Negatives, or which make it maybe not so equitable for care, wait lists, okay? There may be a gap fee, and that is set by the provider. So if your doctor thinks he's better than everybody else, he can charge you an extra 20, 30 bucks, and there's nothing you can do about it except change doctors. And you don't really get a choice of the treating practitioner if you want to go through Medicare, okay? What does this look like at the different levels of government? Well, we've got the federal level, that obviously they're going to outline the schedule and the PBS, okay? So it tells you how much of a treating service that they will cover. At the state level, this is then delivered to our Australians via the public hospital system, okay? And at the local level, like health promotion, okay? So your local community encouraging you to go get checked or go see a doctor and all that kind of stuff, so then you go through the system and yeah, you get the point. Equity of access. All right, so the next one we've got expenditure on like treatment as opposed to early intervention and prevention, okay? So 90% or over 90% of our current healthcare expenditure in Australia is spent on curative services, for example, what you go to the hospital for. That's a lot of money, okay? So if this is $1 billion industry and over 90% of it is spent on curative, like put that in perspective, that means that less than 10% of the money that we allocate to healthcare every year is only spent on health preventative measures, okay? Which, you know, that's not equitable at all. Like, why aren't we spending more money on preventing people getting sick as opposed to just treating them when they're sick, right? Well, a shift to the health promotion programs may increase the health of future generations, okay? So like me, all of a sudden, if I was provided, like, you know, for example, if the government came out tomorrow and said, right, we're gonna cut expenditure on curative services to 50%, and now we're going to put 40% more money into preventative services. To do that, all males over the age of 30 get put on a like healthy choices diet program where you get 5 meals a week sent to your house and you get lifetime access to gyms. Like, that's crazy. All of a sudden I'm getting 5 meals off the government and I'm getting lifetime access to the gyms off the government, with these two things designed to improve my health and prevent me getting things like, you know, lung cancer, cardiovascular disease, all right? All that kind of stuff. But the government's not going to do that, because if they did that, it's going to leave the current sufferers without treatment, all right? So that, you know, you can see this argument, right? All the young people, well, not all the young people, okay, but most of the people that are young, they're like, yeah, we want free gyms, we want, you know, free meals and free healthy meals and all that kind of stuff. But then all the older people who currently have a condition are like, I just want to live. So obviously the government's not going to just like axe the people and say, all right, well, you know, if you're currently over the age of 70, you can die, and then we'll just focus on everyone else with health promotion. Like, that's not cool, especially if you have family members who are in that demographic like I do, all right? So it's a tricky one, okay? This is one of those icky ones that you would need to argue both sides for, and you can sort of see the argument as to why you would want to spend, why 90% or more is spent on curative services, but also you can see the argument as to why maybe we should spend more percentage of this on health promotion, all right? So we could be putting greater funding towards anti-smoking and vaping, all right? Could be putting more funding towards anti-alcohol, and I've got a strategy over here for that. Healthy diet programs, you know, like delivering healthy meals and whatever. or at least getting trained up in how to cook healthy meals, and physical activity, you know, programs, gym memberships, all that kind of stuff, all right? But that would be billions of dollars spent on health promotion as opposed to billions of dollars spent on curative services. The problem, I didn't write it up. The major problem with shifting, okay, all of this is this. No guarantee of success. So we know that like eating healthy meals 7 days a week for every single meal, we know that is a protective behavior, okay, towards cardiovascular disease, diabetes, and all that kind of stuff, reducing obesity. We know that regular exercise is very good for diabetes, obesity, weight management, cardiovascular disease, but also things like mental health, anxiety problems, all that kind of stuff. But they're protective behaviors. They don't guarantee success. So even if you do eat a healthy meal every day of the week, 7 days a week, you can still actually become overweight and obese and get cardiovascular disease, all right? Even if you do go to the gym 7 days a week or 6 days a week or whatever, you can still get all these problems, all right? This is why there's not a shift in expenditure. A potential solution, okay, which you might want to write about if you want. Increase the tax, so the cost, okay, on smokes, so that's already been increased many times over the years. Do it again, okay? Increase the price of vapes. Hang on, I think my door's about to be opened. Increase the price of vapes and vaping, so that so increase the price of vapes and vaping, even though that's now illegal, okay? Increase the price of alcohol. So if you increase the price of alcohol, like just double it. So instead of like a slab costing, I don't even know what a slab costs, I don't drink beer, $50, maybe it costs $100, okay? Yeah, there'd be outrage and all this kind of stuff and whoop-de-doo, but people would still buy it because people love alcohol. But then that money, that extra money that we've made from that, pass that on to health promotion providers, okay? So for every slab that someone buys, someone else gets 2-week access to the gyms or something like that, okay? So we can use that money on poor health behaviors and redirect that to preventative health behaviors, okay? So there's an argument. And think even fast food, okay? Put a tax on all fast food outlets, okay? So now your Happy Meal now costs $9.95, but that extra $5 is put towards a healthy diet program. I don't know. This is my solution. It's not like the perfect solution, but it's a thing. Anyway, that's expenditure. Okay, impact of emerging treatments and technology on healthcare in Australia. So we have positives and negatives about new emerging technologies for treating people that are sick. Positives, less recovery time, okay? Less invasive surgeries, less burden on the hospital system. All of these things equal to billions of dollars every year, okay? So if you don't need to be in a hospital bed for 5-6 days after surgery, you can go home after 2 days because your surgery was less invasive, okay? That's great. That means they've got a free hospital bed to treat another person, okay? However, negatives, expensive. So generally when a new technology or a new treatment method comes out, it's expensive, okay? Because it probably requires the purchase of new equipment, and to try and recuperate some cost of that purchasing of new equipment, they charge it onto the patients, all right? There's generally wait lists, okay? Massive wait lists for new treatments and technology as opposed to things which are old and traditional. And generally, when a new treatment and technology comes out, it's not covered by Medicare. Medicare generally have this rule of 7 years, all right? Especially with medications, okay? Something must be on the market for 7 years and treating effectively before Medicare will actually put it on the PBS when you talk about medication. Examples of things are keyhole surgery, stem cell treatments, all right? All of these things reduce recovery time, they're less invasive, but they do have these negatives as well. So there is a positive and a negative balance between our new treatments and technology, and you would need to probably discuss both points if you get asked in HSC. We've got 1 point left for healthcare in Australia. I think we're on time. All right, so our last one, we've got Medicare versus private health insurance, okay? So positives and negatives for both. The main ones you need to understand for Medicare, remember it is free or subsidized care, which is bulk billing, okay, set out by the schedule. It is accessible to all Australians, and it does include the PBS, the Pharmaceutical Benefits Scheme, which is covering the cost of medication. Negatives of Medicare, there sometimes may be a gap fee, so it's not 100% free. There are often long waiting lists for treatment, so while you don't necessarily need to wait to see a GP, there are going to be longer waiting lists for whatever the GP then tells you need to go and do. And the care level that you will get, or the treatment that you'll get, is going to be the basic, the vanilla, the bland version. So it still works, but it's not going to be fancy, and it may lead to longer recovery times and all that kind of stuff. Private health insurance though, the first benefit is that you actually get access to ancillary care, so that's extras, okay? So you can go and see a dentist, a physio, a chiro, remedial massage. You can actually engage in a healthy lifestyle program, which is like a gym membership, and all that stuff will be partially covered by your private health insurance premium that you pay. You get your choice of provider. So if you had to go in a hospital or get a knee surgery through the public system, so through Medicare, you might be getting operated on whoever just turns up at work that day. But through private health, you can actually go and see Dr. Knee Man because he's the best, right? You can also skip the queue. Well, it's technically not skipping the queue, but there's shorter wait lists, all right, for treatment, all right? So instead of having to wait 6 months for your knee surgery, you can get your knee surgery in 3 weeks. The negatives of private health insurance. It is expensive, like actual expensive. So I think Liz and I pay like $200, I want to say a fortnight. It's like $200 a fortnight or, nah, it can't be $200 a fortnight. That's really expensive. It must be $200 a month. No, I reckon it's $200 a fortnight for private health insurance. And that's not even like top level cover. That's like middle ground because you can choose different levels, right? And the other kicker about private health insurance is that you may not need it. So Liz and I are paying all this money for private health insurance, which we actually may not need. Now, obviously, if something bad happens and we need to be rushed to hospital, we're going to be so thankful that we have private health insurance. But in the case that a whole year goes by and nothing bad happens, then we've just given, our private health insurance provider a bucket of money for no return. So, yeah, I still recommend it. That's healthcare in Australia. Okay, complementary alternative health services. So first of all, got this little tidbit. A complementary service, remember, works alongside our traditional care. So for example, getting acupuncture along with doing your RISA for a soft tissue injury, all right? An alternative health service is one that you use instead of the traditional care. So e.g., using Chinese medicine to balance your hormones instead of taking the daily pill, if you're a girl. So our first dash, we've got reasons for growth. So why is there this increase in people uptaking this stuff? So we've got, first of all, TAFE and University increasing their accredited course delivery. Okay, so instead of you having to be like a witch doctor who was just trained through family or whatever, and then it's a bit iffy, you can actually get a little certificate from TAFE and University, well, not a little certificate, a diploma. Because TAFE and University are saying, well, we're going to provide these courses because this is actually a thing that works. So here you can go and see a chiro, a physio, a naturopath, Chinese medicine, all that kind of stuff, right? It is also included with some or most private health insurance, so that ancillary care, extras care, okay? So if I know that I'm paying this $200 a fortnight for my private health insurance, but part of that is that I can claim back some money on a chiropractor, well then I'd be silly not to go because I'm literally already paying for it. I might as well just go and get it done, okay? Increased multiculturalism, especially in Australia, which brings over a whole different medicine schemes into one place. The holistic health approach, like people are actually starting to be a little bit more health literate and they're trying a whole bunch of things to make themselves healthy as opposed to just going and seeing a doctor. And the last one is like societal trends or basically just social media, okay? You usually don't watch social media and see someone being like, I got healthy by going to the doctor. No, it's like, I got healthy by doing this weird juice cleanse. Don't do a juice cleanse, it's dumb. But I got healthy by doing this weird thing or seeing my physio or getting my back cracked at the chiro or trying Chinese herbs. And then people are like, oh yeah, I want to go do that too. Anyway, that's reasons for growth. Range of products and services. There are lots, okay? So this is just a general nutshell. Natural medicines, okay? So you've got naturopathy, okay? Chinese herbal medicine, all that kind of stuff. You've got an increase in the supplement market, not only vitamin and mineral supplements, but like go to Chemist Warehouse and like I swear, Chemist Warehouse. It's meant to be a chemist. It started off as just a chemist and they sold a couple of supplements. You walk in there now and 3/4 of the store is just aisles and aisles and aisles and aisles of supplements. You can get any sort of vitamin, any sort of mineral you want, any sort of blend of vitamins and minerals. Then you can take all this other stuff as well, which is meant to help with like sleep and energy and recovery and yeah, crazy stuff. But also like just things like the increase with gym culture. You've got increase of those type of supplements like protein, creatine, etc., etc. Physical therapy, so you've got things that actually physically manipulate the body to cause healing or encourage healing. So like osteopathy, chiropractic, physiotherapy, massage, remedial massage, sports massage, Swedish massage. What else we got? Thai massage. It's another type of massage. I don't know. Anyway. And lastly, you've got like energy therapy, so acupuncture, meditation. So trying to balance the energies in the body to promote healing. And I'm not exactly sure how that works, but apparently it does. All right, so our last one, how do we make informed choices? How do we know that what we're going to get is actually a good thing or a bad thing, or it has like low risk, high risk? Is it actually going to help me at all? First of all, qualifications, okay? So we already talked about how TAFE and universities are offering degrees around these things. If that person has a degree from a reputable government-held body like a TAFE or university, then that's pretty good, okay? As opposed to somebody who got it out of a cereal box or just did it over the phone or did like an online internet course with like, and then they just printed off a certificate at the end. That stuff's a bit dodgy. Does the service have an accredited provider, okay? And as in like a regulating body that they need to report to like every 12 months, okay? Like the Australian National Chiropractic Association, that kind of stuff. So all chiropractors need to be accredited through them to be able to deliver chiropractic in Australia. And if they're not accredited by them and they don't have to prove their qualifications and they're not keeping up to date with their training, then they can't actually deliver the service. Has there been a recommendation from a family and friend, someone you trust? Have they gone and saw the person and they had success? All right, that's usually a pretty good indication that it's good, okay? And then lastly, is there research and evidence behind what you're actually going to get? And I don't mean like Dr. Google research, because if I can just type into Google, I could type into Google, will a juice cleanse fix my diabetes? And I bet you there'll be like 10 articles that say, yes, a juice cleanse will fix your diabetes, when that's ridiculous. But is there actually like scientific evidence behind this stuff, okay? Can I actually get this therapy to help me with my condition or situation? Yes or no, all right? Finally, I want to finish off this section, Complementary Health Services, with this is a stance. This is my point of view, okay? You can agree or disagree as much as you want. You may want to write about it in your answers, but I believe, okay, if I was writing, this is what I would say. A person diagnosed with a chronic or life-threatening condition should engage in as many complementary therapies as possible. Like that's what I would do. If I was told tomorrow, like touch wood, this doesn't happen. If I was told tomorrow that I have a certain type of cancer, I would be seeing my doctor, obviously, so doctor, hospital, whatever, getting all of that treatment like chemotherapy or whatever they want to do, along with doing all of the other things. I would do energy therapy, I would do like Chinese medicine, I would do acupuncture, I would be doing naturopathy, like I would be doing everything that I could to make myself healthy again, okay? And that's what I believe that everyone should do. But like I said, that's just my point of view. And that's the end of this summary video.